a operating room, a veteran under anesthesia, and suddenly, words that changed everything. What seemed like just another routine procedure turned into the most terrifying and revealing moment of my career as a nurse. When that man shouted Operation Overlord and reached for my ID badge, something inside me froze. What did he know? Why me specifically? This is the story of how a decades-old secret came to light on an operating table, connecting past and present in a way I never imagined possible. My name is Helena Whitmore, and I have been working as a surgical nurse at Providence Memorial Hospital in Boston, Massachusetts, for the past 8 years. The cold winter mornings in this city, with its brick buildings and streets covered in early snow, have become part of my routine. Every day, I walk through those automatic doors knowing that behind them, lives hang in the balance, and my role is to ensure that every procedure, every instrument, every second counts. I grew up in a family of strong women. My grandmother, Louise Brennan, was a war nurse during World War II. She worked with the Red Cross in France, caring for wounded soldiers during some of the darkest days in human history. My mother, Catherine, followed a different path, becoming a teacher, but she always spoke with pride about her mother's bravery. I, in turn, felt that nursing was in my blood, a legacy I needed to honor. That Tuesday in February started like any other. The hospital hallways echoed with the familiar sounds of monitors beeping, hurried conversations, and gurneys being pushed urgently. I had just finished my second cup of coffee when Dr. Marcus Rivera approached me in the prep room. His expression was serious, more than usual. An emergency case, he explained. A 92-year-old veteran with severe cardiac complications. The surgery needed to happen immediately. His name was James Patrick O'Sullivan. According to his medical records, he was a decorated World War II veteran, specifically from D-Day operations in Normandy. He had survived the beaches, the battles, 7 decades of life after the war, and now his heart was failing. As I reviewed his chart, something stirred inside me. My grandmother had been in Normandy too. The coincidence felt strange, but in a city like Boston, full of history and veterans, it was not entirely unusual. When they brought Mr. O'Sullivan into the operating room, I saw a fragile man, his skin marked by time, his breathing labored, but there was something in his eyes, even through the pain and confusion, a strength that spoke of a life fully lived. As we prepared him for anesthesia, he looked directly at me, not at Dr. Rivera, not at the other nurses, but at me. His gaze was intense, almost as if he were trying to remember something important. The anesthesiologist, Dr. Sandra Kim, began administering the sedation. We had done this procedure hundreds of times. Everything was following protocol perfectly. Mr. O'Sullivan's eyes began to close slowly as the medication took effect. His vital signs stabilized on the monitors. We were ready to begin. Dr. Rivera made the first incision with precision while I assisted, handing instruments, monitoring the screens, doing what I had been trained to do for years. But then, something happened that no amount of training could have prepared me for. Before I continue, I want to know something from you. Where are you watching this story from? It is always incredible to see people from so many different places following these accounts. Write it there in the comments, I really want to know. About 15 minutes into the surgery, while Dr. Rivera was working on exposing the damaged cardiac tissue, Mr. O'Sullivan began to murmur. At first, they were incoherent sounds, the kind of thing we sometimes hear from patients under anesthesia. The brain, even sedated, can produce strange fragments of thoughts, memories, dreams. Dr. Kim checked the anesthesia levels. Everything was normal. The patient was deeply sedated, his body completely relaxed. But the murmuring continued, and then they started to form words, disconnected phrases in English, but also something else. French, broken, agonized French. Les plages, the beaches, so much blood, tant de sang. His voice was weak but persistent. The entire surgical team exchanged quick glances. This was unusual, but not entirely alarming yet. Sometimes traumatic memories surface during anesthesia, especially in elderly patients with military backgrounds. Dr. Rivera continued working, his hands steady despite the distraction. I tried to focus on my tasks, but something about those words was affecting me in a way I could not explain. My grandmother had told stories about the beaches of Normandy, about the blood, the chaos, the impossible decisions she had to make as a young nurse in the middle of war. Hearing those same words from this stranger felt like the past was invading the present. Then the murmuring stopped. For about 5 minutes, there was only the sound of the monitors, the surgical instruments, our breathing behind the masks. We all relaxed slightly. Perhaps it had just been a brief episode. We continued the delicate work of repairing Mr. O'Sullivan's heart, each movement calculated, each second critical. And that is when everything changed. Without warning, Mr. O'Sullivan's eyes shot open, not slowly, not gradually, but violently, as if he had been jolted awake by an electric shock. His right arm, which should have been completely immobilized by the anesthesia, lifted from the operating table. Dr. Kim immediately moved to increase the sedation, her face showing alarm. This should not be happening. This could not be happening. But before anyone could react, before Dr. Kim could push more medication through the IV line, Mr. O'Sullivan's hand shot forward with surprising strength for a man his age and in his condition. His fingers closed around my ID badge hanging from my scrubs. His grip was firm, desperate, and then he spoke. Not murmured, not whispered, but spoke with a clarity that made everyone in that room freeze. Operation Overlord. His voice was loud, urgent, filled with an emotion that transcended the physical limitations of his sedated state. Operation Overlord, June 6th, Omaha Beach. Louise Brennan, the nurse with the green eyes. My heart stopped. The room spun. Louise Brennan, my grandmother's maiden name, the name she had before marrying my grandfather Robert Whitmore in 1947, 2 years after the war ended. How could this man know that name? How could he know she had green eyes, the same green eyes I inherited and see in the mirror every day? If this story is gripping you as much as it marked me, subscribe to the channel now. We are close to reaching our goal of 500 subscribers, and your subscription makes all the difference, so that more people can discover exciting stories like this one. Dr. Rivera had stopped operating. His hands, which moments before had been working with absolute precision inside Mr. O'Sullivan's chest, were now frozen in midair. Dr. Kim had managed to administer more sedation, and slowly, Mr. O'Sullivan's grip on my ID badge loosened. His arm fell back onto the table. His eyes closed again. The monitors showed his vital signs returning to stable levels, but the damage was done. The words hung in the air like ghosts. "Helena, are you okay?" Dr. Rivera's voice broke through my paralysis. I realized I was trembling. My hands, which had been holding a retractor, were shaking visibly. This was completely unprofessional. In 8 years of surgical nursing, I had never lost my composure in an operating room. But this was not about professionalism. This was about something that reached deep into my family history, into a part of my identity I thought I understood. "I am fine," I lied, forcing steadiness into my voice. "Let's continue." But I was not fine. My mind was racing through every conversation I had ever had with my grandmother before she died 15 years ago. She had talked about the war, about the soldiers she had cared for, about the horror and the unexpected moments of humanity she had witnessed. But she had never mentioned anyone named James O'Sullivan, or had she? There had been one story, told only once, late one night when I was 16 years old. We were sitting in her small apartment in Cambridge, the one with the window overlooking the Charles River. She had been looking at old photographs, black and white images of young men in uniform, nurses in their crisp white dresses stained with mud and blood, and she had said something strange. There was one soldier, one who I thought about every day for years after the war. But life takes us in different directions, Helena. Sometimes the people we are meant to find, we lose in the chaos. I had asked her what she meant, who this soldier was, but she had closed the photo album abruptly, wiped a tear from her eye, and said it was time for bed. I never asked again. And then, 5 years later, she was gone. A stroke, sudden and merciless. All her stories, all her secrets, gone with her, or so I thought. Dr. Rivera resumed the surgery. His professionalism was admirable, his focus absolute. But I could see the questions in his eyes, the same questions that were tearing through my mind. How could a sedated patient, in the middle of cardiac surgery, speak my grandmother's maiden name? How could he describe her eyes with such specificity? This was not a common name. This was not a lucky guess. The surgery continued for another hour and 40 minutes. Every second felt like an eternity. I performed my duties mechanically, my hands moving through muscle memory while my mind was elsewhere, decades in the past, on beaches I had never seen but had heard described in painful detail. When Dr. Rivera finally closed the incision and declared the procedure successful, I felt no relief, only an overwhelming need to understand what had just happened. As they prepared to move Mr. O'Sullivan to the recovery room, I stood there, staring at his unconscious face. Who was this man? What connection did he have to my grandmother? And why, after all these years, after her death, after I thought I knew everything about where I came from, was the universe throwing this impossible coincidence in my face? If this part moved you as much as it moved me, leave your like now. This way YouTube understands that this story deserves to be seen by more people, and it helps the channel continue to grow. As I could not go home that night. After my shift officially ended at 7 p.m., I stayed at the hospital, wandering the corridors, unable to shake the image of Mr. O'Sullivan's desperate grip on my ID badge. The February wind howled outside the windows, and the hospital seemed quieter than usual, as if the building itself was holding its breath, waiting to see what would happen next. I went to the staff lounge and made myself another coffee, my fourth of the day. My hands were still shaking slightly. I pulled out my phone and opened the photo gallery, scrolling back through years of images until I found what I was looking for. A photograph I had taken of one of my grandmother's old pictures. It showed her in her Red Cross uniform, standing in front of a field hospital tent somewhere in France. The year was written on the back in her handwriting, 1944, Normandy. She looked so young in that photo, barely 23 years old. Her dark hair was pulled back under her nurse's cap, and yes, those green eyes were unmistakable even in black and white. There was a certain sadness in her expression, a weight that seemed too heavy for someone so young to carry. I had always attributed it to the horrors of war she must have witnessed. But now, I wondered if there was something more, someone more. My mother had always told me that my grandmother met my grandfather, Robert Whitmore, at a veterans' dance in Boston in 1946. He had served in the Pacific Theater, came home decorated but damaged, and found solace in the quiet strength of a nurse who understood trauma without needing explanations. They married quickly, had my mother in 1948, and built what everyone described as a solid, if not particularly passionate marriage. But what if there had been someone before? What if in the chaos of Normandy, in the blood and desperation of the days following D-Day, my grandmother had met someone she thought she had lost forever, someone named James Patrick O'Sullivan? I thought back to other moments, other fragments of conversations that at the time seemed insignificant, but now took on new meaning. Once, when I was helping my grandmother sort through old belongings, I found a small box hidden in the back of her closet. Inside were military dog tags, not my grandfather's. The name on them was partially worn away, but I could make out JO's and part of a service number. When I asked her about them, her face had gone pale. She took the box from my hands quickly and said they belonged to a soldier who had died, someone whose family she had never been able to locate. She said she kept them to honor his memory. At the time, I believed her. Now, I was not so sure. Had those dog tags belonged to James O'Sullivan? Had he not actually died? Had they been separated by the chaos of war, each believing the other was gone, only for my grandmother to build a new life back in the States while he survived and built his own? Around 9 p.m., I made a decision. I accessed the hospital's database, something I technically was not supposed to do outside of direct patient care, but I justified it as professional follow-up. I pulled up James O'Sullivan's complete medical records. The information was extensive. Born in 1932 in Southie, the Irish neighborhood of South Boston. Enlisted in the Army in 1950. Wait, that did not make sense. D-Day was in 1944. He would have been only 12 years old. I scrolled more carefully through the records. Then I saw it. A correction note. The birth year listed was wrong in the system. A data entry error from when his records were digitized. His actual birth year, according to a scanned copy of his original enlistment papers, was 1922. That made him 22 years old on D-Day, the same age as my grandmother. I kept reading. He had served with the 1st Infantry Division, the big red one. They had landed on Omaha Beach on June 6, 1944. The casualties were devastating. According to his service record, he had been severely wounded on June 8 during a German counterattack and was evacuated to a field hospital where my grandmother would have been working. My hands gripped the edge of the desk. This was not a coincidence. This could not be a coincidence. They had been in the same place, at the same time, both young and far from home, surrounded by death and destruction. It made perfect sense that they would have met, that they might have formed a connection, maybe even more than a connection. But the records showed that Private O'Sullivan was listed as missing in action for 3 weeks in July 1944. He was part of a reconnaissance mission that went wrong. His unit was ambushed. Of the 12 men who went out, only 2 came back, and O'Sullivan was not one of them. He was presumed dead. The official death notice was sent to his family in Boston, except he was not dead. According to later records, he had been captured by German forces, held in a makeshift POW camp, and eventually freed by advancing Allied troops in early August. By that time, the war had moved on. The field hospitals had relocated. Nurses were rotated. The chaos meant that reconnecting with someone, even someone you desperately wanted to find, would have been nearly impossible. My grandmother must have thought he was dead. The notice would have been posted. His name would have been on casualty lists, and she was pregnant. The realization hit me like a physical blow. I stood up so quickly that my chair rolled backward and hit the wall. My mother was not my grandfather's biological daughter. My mother was James O'Sullivan's daughter, which meant this man lying in a hospital bed 2 floors above me was not just a patient. He was my biological grandfather. I did not sleep that night. I sat in my car in the hospital parking lot, the heater running to keep away the February cold, and I tried to make sense of everything. If what I suspected was true, if my mother was James O'Sullivan's biological daughter, then everything I thought I knew about my family was built on a foundation of secrets and half-truths. My grandmother had returned to the United States in late 1945 after the war ended in Europe. According to family stories, she arrived in Boston in October. She met my grandfather Robert at that Veterans Dance in March of 1946. They married in June. My mother was born in April of 1948. The timing worked for Robert to be her father, but it also worked for someone else to be her father if my grandmother had already been pregnant, or if my mother had been born earlier and the birth year was adjusted. People did that sometimes in that era, hiding pregnancies, avoiding scandal, but I had my mother's birth certificate. I had seen it multiple times. It listed Robert Whitmore as the father. It listed April 19th, 1948 as the date of birth. If those were lies, they were official lies, documented lies, the kind that would have required deliberate deception, not just omission. At 6 a.m., I finally went home to my small apartment in Cambridge, showered, changed, and tried to eat something, though food seemed impossible. At 8 a.m., I was back at the hospital. I had called in and requested permission to be assigned to Mr. O'Sullivan's recovery care. It was unusual, but not unheard of, for surgical nurses to follow up on cases that had gone unusually. My supervisor, thinking I was simply being thorough after the strange episode in the operating room, approved it. I entered the recovery ward with my heart pounding. Mr. O'Sullivan was awake. He looked exhausted, pale, but his eyes were alert. An IV line fed medications into his arm. Monitors tracked his heart rate, blood pressure, oxygen levels. Everything was stable. He had survived the surgery. His body, at least, was recovering. When he saw me approach, something changed in his expression. Recognition, but also confusion. He looked at my ID badge, at my face, back at the badge. His lips moved, forming words, but no sound came out at first. I pulled a chair close to his bed and sat down, trying to appear calm and professional, even though inside I was screaming with questions. "Mr. O'Sullivan," I said gently, "I am Helena Whitmore. I was one of the nurses in your surgery yesterday. How are you feeling?" He stared at me for a long moment. Then, in a weak but clear voice, he said, "Whitmore. She married a man named Whitmore. I heard that. Years later. Someone told me. Louise Brennan married Robert Whitmore." The world stopped spinning. He knew. He remembered. This was not a delusion. This was not anesthesia confusion. This was real. I tried to keep my voice steady. "You knew my grandmother. Louise Brennan was my grandmother." Tears formed in his eyes. Not the tears of physical pain, but something deeper, older. I thought I would die without ever knowing, without ever seeing anything of her again. But you have her eyes. Exactly her eyes. The moment I saw you yesterday, even through the sedation, something in my mind recognized those eyes. I leaned forward, my professional composure crumbling. "What happened? Between you and my grandmother? What happened in France?" He closed his eyes, and for a moment I thought he might be too weak to continue. But then he began to speak, his voice carrying me back 80 years to a world of war, fear, and a love that was supposed to be impossible. "I was 22 years old," James began, his voice distant, as if he was seeing it all again behind his closed eyelids. "Just a kid from Southie who thought war was going to be an adventure. Omaha Beach taught me otherwise. I watched my best friend die next to me in the first 5 minutes. Tommy McCarthy. We had grown up on the same street, played baseball in the same lot, enlisted together. He took shrapnel to the neck before we even made it off the beach. There was so much blood, so much screaming." He paused, his breathing becoming labored. I checked his monitors. His heart rate was elevated, but not dangerous. I knew I should tell him to rest, to save his strength, but I could not. I needed to hear this. I needed to know. "I was wounded on the 8th of June, he continued. "We were pushing inland, trying to secure a crossroads near a village called Saint Laurent. Germans had a machine gun nest we did not know about. Caught us in the open. I took a round through my left shoulder, and another grazed my side. I went down hard, thought I was done. But 2 guys from my unit dragged me back. They got me to a field hospital about 3 miles from the beach. "That is where you met her," I said softly. "My grandmother. That is where I met Louise," he confirmed. And the way he said her name, even after 80 years, was filled with such tenderness that it made my chest ache. She was the first person I saw when I woke up. I was on a cot in a tent that smelled like disinfectant and blood. There were dozens of wounded men around me, some screaming, some silent. And there she was, this angel with green eyes, cleaning my wounds, telling me I was going to be okay. Her hands were so gentle. Her voice was so calm. In the middle of all that hell, she was like a piece of heaven. He opened his eyes and looked directly at me. I fell in love with her that first day. Over the next 3 weeks, while I recovered enough to go back to my unit, We talked. We talked about everything. Our families back home. Our dreams for after the war. She told me about wanting to open her own clinic someday. I told her about wanting to be a teacher. And you fell in love with her, I said. And she fell in love with you. Yes, he whispered. We both knew it was impossible. But we stole moments. One night in late June, we walked together to a small church that had somehow survived the shelling. We sat in the ruins and talked about what life might be like if we both made it home. He stopped, and I saw him swallow hard, fighting emotion. I asked her to marry me that night. I did not have a ring. I did not have anything except a promise. But I asked her, and she said yes. She said when the war was over, she would find me in Boston, and we would get married and have a family and try to forget all the horror we had seen. My throat was tight. But you did not make it back to her. I tried, he said. In early July, I was sent back to my unit. We were part of a reconnaissance mission. We got ambushed. I was captured. They took me and 4 other guys to a temporary POW camp. My unit thought I was dead. They sent the notice. And my grandmother received that notice, I said, the pieces finally falling into place. She thought you were dead. I did not know that at the time, James said. When Allied forces finally freed us in early August, I was in bad shape. By the time I was well enough to try to find her, I learned that the field hospital where we met had been disbanded. I tried everything. I could not find her. He looked at me with such sadness. I did not find out she had made it home until 1949. I met a guy who had also been in Normandy, and somehow in conversation, your grandmother's name came up. He said she was living in Boston, married to a veteran named Robert Whitmore, and that they had a baby girl born in 1948. I did the math. I knew, or at least I suspected, but what could I do? She had moved on. She thought I was dead, and she had built a life. What right did I have to destroy that? So I stayed away, but I never stopped wondering. I never stopped thinking about Louise and about whether that baby girl was mine. Did you ever try to contact her, my grandmother? Once, he admitted, in 1965. Patricia had died the year before. I found her address and went to her house, and then I saw her. She was in the garden with a teenage girl. Your mother, I assume. They were laughing together. I realized I had no right to disrupt that, so I left. I never contacted her. I never told her I had survived. I need to know for certain, I finally said, whether my mother is your biological daughter. Would you be willing to take a DNA test? James nodded slowly. I have wondered for 77 years. Yes, I need to know too, even if the truth is painful. I, a medical professional, quickly arranged the test, obtaining James's sample and later, a DNA sample from my deceased grandmother, Louise's hair from a preserved brush. The waiting period was fraught with ethical wrestling. The results came back 5 days later. The genetic analysis was clear and unambiguous. James Patrick O'Sullivan was the biological father of my mother, with a probability of 99.97%. The man I called Grandpa Robert was not my biological grandfather. That evening, I gave James the results. He broke down in deep, wrenching sobs. I knew. I have a daughter. I have had a daughter all this time and never got to know her. And a granddaughter. You. He asked the dreaded question. Does she know? Your mother? Does Catherine know? No, I said. I have not told her yet. I explained the weight of the truth on her life and on the memory of Robert Whitmore. James acknowledged that Robert was her father, in every way that mattered. But I would like to meet her, if she is willing, just once. I do not have much time left. I would like to look my daughter in the eyes and tell her about her real mother. The young woman I fell in love with in a field hospital in France. I will ask her, I promised. I called my mother Catherine that night, demanding she come to Boston. The next day, I told her everything. James's story, the Operation Overlord shout, the records, and the DNA test results. She listened silently, moving from shock to numb acceptance. So Robert Whitmore was not my biological father. No, I confirmed gently, but he was your father in every way that mattered. Her face hardened. Everything changes, Helena. Everything I thought I knew about where I came from is all based on a lie. My mother lied to me my entire life. She was supposed to tell me the truth. I tried to soften the blow, mentioning the chaos of war and her believing James was dead, but Catherine's anger was focused on the deliberate silence. So both of my biological parents decided independently that I was better off not knowing the truth. Did it never occur to either of them that I might want to know where I really came from? He wants to meet you, Mom. James, he does not have much time left. After an hour of private struggle, she said, her voice steady, take me to him. Now, if I wait, I will lose my courage. Take me to meet my father. And when we arrived, James saw Catherine and his face transformed. His eyes filled with tears. Catherine, he whispered, oh my God, you look just like like her, just like Louise when she was young. Catherine sat close and confronted him about finding out about her existence in 1949 and doing nothing. James flinched. What would you have had me do? She had married another man. If I had shown up and claimed you were mine, I would have destroyed her marriage. I gave up my daughter to protect her, and it has eaten me alive every day since. Catherine's anger softened. Tell me about her, about my mother, the woman she was when you met her. James's face lit up as he described Louise's quiet bravery, her laugh, and the dream they shared of having 3 children, the first named Catherine. Tears streamed down my mother's face. He showed her the small, worn, black and white photograph of Louise he had carried for 80 years. It is yours, James said. Everything I have that belonged to her, it is all yours. My mother kissed him on the forehead. Thank you for telling me that. Thank you for loving her, and thank you for respecting her choices, even when it cost you everything. James Patrick O'Sullivan died 6 weeks later, but in those weeks, a family was forged. Catherine visited him almost every day, sharing photo albums of the life she built. James shared stories of his life, including his career as a high school history teacher, the same profession Catherine had chosen without knowing they shared that calling. The initial anger in Catherine evolved into acceptance, forgiveness, and a sense of identity she had been missing. She realized that knowing she came from a love story, even a tragic one, was healing. James gave Catherine his dog tags, the letters he had never sent to Louise, and the contact information for his sister's granddaughter, a newly discovered cousin. 3 days before he died, James called me alone to his hospice room. Helena, I need you to promise me something. The story I told you, the story of Louise and me, I need you to keep it alive. Tell them that love can survive impossible circumstances, and tell them that their great-grandmother was the strongest, bravest, most beautiful person I ever knew. I promise, I said through tears. He smiled. Good, because this story deserves to be remembered. We had 3 weeks together in Normandy, Louise and I. Those 3 weeks were worth more than all the years that came after. That is what love is, Helena. It is not measured in time. It is measured in depth, in impact. We buried him next to his wife, Patricia, but on his gravestone, we inscribed, "Beloved father of Catherine, in loving memory of Louise." In the months that followed, Catherine discovered an entire extended family branch of O'Sullivans, and among James's possessions, we found a letter from Louise to him, dated June 1944, a note of prayer and hope for their future together, which he had carried until his last day.